everyone a chance to jump on. I am your host, Dr. Rahi Victory, a reproductive endocrinology and infertility specialist, double board certified in Canada and in the US. And welcome to our show. We have a great show for you tonight, and we're going to be answering lots of questions. And we finally have an interesting new little segment where we're going to taste test something that was brought to our attention through our viewers. So once Tarek is finished trying to unscramble TikTok from this system, we will happily be able to accommodate everybody's questions and concerns and go over everything all together. I don't actually get to see your comments tonight because we have some new gizmos going. He's looking kind of confused, kind of happy. I can't read your expression. Where are we at? You're typing fast. Pressure? You ever being live in front of 5,000 people? Man?
I feel like I always am. I feel like that's my thing. You're going to be categorized as fitness and sports.
Yeah.
For right now.
Yeah, because that's me. Fitness and sports. Are we on?
Yeah.
TikTok?
I think.
You think?
Yeah.
Should we look?
I'm looking.
Look? I'm going to check.
Uh-huh.
Check us out. All right. Are people jumping on?
I hope so. I'm going to check. I'm going to see what we're doing here.
So we have a interesting show tonight as we get our new computer system up and running. And we are going to answer your questions like we always do. That's the point of our show. We advocate for you, so you don't have to advocate for yourself. Please feel free to check us out on YouTube, where we have hundreds of videos now pertaining to previous shows, special topics. We actually put one up I thought would get way more traction about the risks of birth control. And there are actually risks of birth control, so that's really critical. And so we included that for people to be aware of. We're going to do a menopause video sometime in the near future. And yeah, we're working on a whole bunch of different topics. You're looking very unhappy right now, my friend.
I know. We'll figure it out. Give me your phone. Give me your phone.
All right, here you go. YouTube is good.
Mm-hmm.
Instagram is good, all that stuff. Okay, so tonight, our special treat, while you figure out TikTok, I'm assuming. Do you want to just like mount my phone up for TikTok for now?
No, I think we can commit.
You can manage it?
Yeah.
So our friends who watched the show went after we talked about date fruit, and we have a video on YouTube about the benefits of date fruit for pregnancy and labor, and talked to someone in town who was a super interesting guy that dropped by tonight to meet us, because the fans of the show went on and spoke to this guy who has a company called Nuts for Dates. He has provided us samples of Nuts for Dates. I have no advertising relationship with this gentleman, and I actually have never tried one of these before. But they come in these really cute little packages. He's got an ordinary one, and then the exact same thing in a Christmassy version. And they're kind of light in calories, only about 100. The date fruit, where did he say? Imported from Saudi Arabia, right?
That's what he said, yeah.
I would have thought you'd have to go all the way out to Saudi Arabia to get dates. Ingredients, all natural stuff. Dates, pistachios, peanuts, walnuts, hazelnuts, and cocoa, which is actually Nutella, which is on one of them. Unsweetened coconut, almonds, a little bit of sea salt, and the oil from the peanuts, but not actually peanut oil. So we're going to try these out. Do you have a preference for which one I give you? Or are you just going to try whichever one I hand over to you?
We're just trying to get the...
Okay, so lovely little packaging. I'm going to show you guys. Can you see that on the camera?
I got a camera situation going on here.
And I'm going to try one. Which one should I try first? Coconut?
Oh, I see you on Instagram. On Instagram, you're good. On TikTok, I just don't know if there's audio on TikTok. I'm struggling with that.
All right. Well, I'm going to try it. It's very squishy.
It is. Eh? He said it would be.
He said it would stick to the wall if we cut it in.
If we cross section.
I'm not going to try that, but here we go.
Solid.
Oh, really good. There you go. Promo. I think I got walnut. Here. Oh, that's amazing. Here. That is really, really good. Just don't get it all over your brand new computer. Okay, so very sticky, very tasty, nuts all the way through. Nuts for dates, 100 calories. Our very dear new acquaintance, Fadi, who makes them. Isn't that good?
Very impressive.
Super Middle Eastern,
Very impressive.
but really tasty. That's good. That will go very well with tea, which I have handy. So I'm ready to take your questions.
I need to prop this up. I'm going to end the live here.
The whole live?
Just for TikTok.
Oh,
There's
don't end the whole live.
no,
That would be bad.
not great though. There's no audio on the live for TikTok somehow.
Weird.
Because the microphone's going here.
Mm-hmm.
I think we're supposed to set it up backwards, have it live on TikTok, share the screen of this app. I'm just too.
Oh, don't worry. I'll prop it up. You got it?
Yeah, we'll get it. We'll get it. And I'll mirror it for you as well.
Oh, yeah. There you go.
Oh, yep.
Yeah. Well, looks vaguely promising. It's a little up my nostril, but that's okay. Good. We're fine there.
All right, we're managing.
Yeah.
It's a live show.
It's a live show. Okay, questions. That was really good. I'm kind of tempted to eat another one, but like I won't be able to talk because my mouth will be full of dates. So he like crushes the dates and grinds it up with the nuts. So when you cut through it, it's all nuts. It's really good. I like that a lot. Very sweet.
Oh, it's great for tea.
Mm-hmm.
Okay.
Fire away.
Okay. And then hold on.
Nuts for dates. Who would have thunk it?
Um
Hopefully I don't go into labor.
no. It makes it easier. I just don't know if that applies to you. You have to be pregnant first.
Fire away.
Okay. I need to log in.
There's no more barriers to being pregnant.
That is I've heard that.
Yeah.
I have absolutely heard that.
Yeah.
Okay.
Yeah.
All right. We're gonna start with the with YouTube.
Okay.
Hi, Dr. V. I see a lot of people talking about fresh frozen transfers. Can you please explain this? Is this for endo patients? Thanks.
Fresh frozen transfers?
Yeah.
Fresh versus frozen transfers or just fresh frozen transfers?
They didn't say the word verse. They said about fresh, no comma, just next word, frozen transfers.
So frozen transfers are generally the way to go these days. There are a lot of benefits. It's a safer pregnancy. It's probably a little bit of a higher success rate in most cases, but not all. Less preeclampsia, less intrauterine growth restriction. So there are some benefits to doing it. The downside of frozen embryo transfer is really very minimal. There isn't really one that is well established or known. For endo patients, a fresh transfer can only, or I shouldn't say can, should only be done when you have a very low 2, 3 or less. If you have more than 2 or 3 eggs, it makes absolutely no sense to do a frozen embryo, a fresh embryo transfer, because your estrogen levels are going really high. And when you have really high estrogen levels, you're fueling or stimulating the endometriosis. And the worst possible thing is going to be that you fuel or stimulate endo when you're trying to do an embryo transfer, because we know that endo is a negative for that.
Hi, Dr. VNT. What are your thoughts on proceeding with FET with a 6.5 millimeter lining? I have a history of thin lining and struggle to get it thicker.
I mean, the studies would suggest that it's a little bit of a lower chance, but it's awfully close. So it's not terrible. And if you can't get it thicker than that, that's reasonable as long as the rest of the criteria are there. AAA or hormones are normal, all of that stuff. There are options for thickening, vitamins, Viagra, vaginal Viagra, baby aspirin, PRP, Neupogen, human growth hormone. So there's a bunch of different things that can help. But if you tried all of those and it's not working, I would certainly be willing to try. My good friend Erica on TikTok asked a question.
Sure.
And I have to answer that question. So she had a sky high AMH of 108, and she asked if there's any long-term health issues. No, there are no long-term health issues from having a very elevated AMH. And how's the baby? And say hi to Nico. Go ahead.
Okay. If my AMH is low-ish, 1.3, but my age is 32, would I be more likely to have abnormal eggs?
Yeah, that's a big question, and there are different groups of studies. So one group of studies, actually there was a debate at American Society of Reproductive Medicine on this with a whole panel, and I sat in on the panel and kind of laughed because I honestly didn't think they knew what they were talking about. So on the one side, there was one individual who said it does look like the embryo quality is not as good, obviously mainly related to eggs. And on the other hand, the other side of the panel said, no, the embryos don't make any difference at all. I think it actually biologically doesn't make sense that the embryos wouldn't be worse. So in other words, it should be that if your AMH is lower, your egg quality is lower as well. But there is still a bit of a question mark about that. I can tell you certainly when we do PGT testing on women with lower ovarian reserve, they do appear to have a lower percentage of genetically normal embryos. So I believe that it does relate to the egg quality, but the data is still not 100% clear on that. And Erica says the baby is good.
Nice.
She's a very cute baby. Yeah, which looks very much like her partner.
There you go. Hi, Dr. V, and honorary Dr. T.
Honorary T. There you go.
There we go. I take it. What does it mean? This is for you.
Yeah.
When baseline estrogen is less than 15 and FSH is less than 1.5. These are US units, and I'm 40 years old. Seems unusually low and much lower than my recent baselines.
Yeah, that sounds like suppression. So either you took something or did something that suppressed you. So that could be a concern. So make sure you're getting checked out and being evaluated for that.
See, I'm like the best doctor in the world, because when I don't know something, I just go to the specialist right away. I don't even pretend, you know?
The best or something.
Yeah, or something. Or something. Can you still get pregnant with low estrogen?
Yeah, people get pregnant with low estrogen all the time. In fact, we intentionally keep our patients' estrogen low when we're doing frozen embryo transfers because it makes it a safer pregnancy. Thin lining is a different question, but low estrogen is not a problem.
And how is your cat doing?
Mithril is so cute. My kitty cat is adorable, and I love him very much. He's super cute. He loves Wendy way more than he loves me, but he's an adorable little kitty. So, yeah.
Trigger versus no trigger, and why for natural cycle transfer?
Okay, so you can do either one. The studies show that there's absolutely no difference. We don't trigger because I find it's much more difficult to manage your progesterone if we do trigger you. Because then your natural progesterone is rising, and the progesterone we give you, we have to recalibrate. And then initially you got to start high. And then as your progesterone's building up, you got to go down, and then your progesterone will die off. You got to go back up. It's like chaos. So I just like skipping that and keeping it nice and easy. So we don't trigger, but you certainly can. There's no harm to triggering. Erica's asking, what about Toby? That's the outdoor cat.
It's the street cat.
Toby is lovely as well, but we don't know what to do because he's outside, and now he started killing creatures. We keep finding bird bits.
Really?
And Wendy said he tore apart a mouse the other day right in front of the
He's a
door.
scavenger.
He's a scavenger, yeah. So I don't know how
he's a lion.
I don't know how safe he'd be inside.
Oh, wow.
Not to mention he might tear apart mithril, which would not be cool. Wendy would never forgive me. So yeah.
Can women with high NK cells use Viagra to thicken their lining?
Women with high NK cells use Viagra to thicken their lining. Not only can you, you should. It's being shown to reduce NK cell activity. So vaginal Viagra is one of the things we use for women with immune-mediated infertility. Yeah, absolutely. It's a great choice.
I had a hysteroscopy to remove a scar, tissue septum repair. After 2 failed transfers, this was found. How quickly will the scar tissue grow back? And there was a balloon catheter replaced after. Question.
So the scar doesn't necessarily grow back. So it shouldn't. If it does, it'll usually grow back right away. And what was the other part of the question? How quickly will it grow back?
How quickly will it grow? Balloon catheter was placed after.
Yeah, the balloon should hopefully prevent it from rescarring. It doesn't always work, but usually it's pretty effective.
Do you check DHEAS and testosterone prior to prescribing DHEA and androgen to your patients?
No, we don't, because it's extremely rare to find someone that's high unless they're PCO. And if you're PCO, you don't need DHEA. So it's very, 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 very rare to find someone that is struggling with diminished ovarian reserve but has high androgen levels. Having said that, we do check DHEAS and testosterone in all of our female patients, but we do it at the beginning. We're not rechecking it later on. Is that your computer making weird noises?
Notifications. It's all new. It doesn't know it needs to mute.
That's the problem with
everything.
With PCs. They're always giving you some kind of notification.
And it's going.
Yeah.
Arabia is the utmost best place to get the best quality dates.
There you go.
There you go.
I had no idea. That was really good. I could
eat that whole box. I get it.
Go through that.
I get it.
Yeah.
When he was saying, I'm like, oh, okay. And the truth is, yeah.
Yeah, it was good.
You could effortlessly eat that whole box.
You could, yeah. Yeah.
What do you say? You eat one date, it's your fiber intake for the day?
Yeah, he said one of those little tiny balls has your daily fiber intake.
I feel like I can carry a house.
Okay, then.
Yeah, full of power. Hi, Dr. VNT. Interesting question. Never had this question before.
Okay.
Is it safe for me to get a kitten and change the kitty litter during TTC or pregnancy?
Only if you've previously been exposed to the fungus that is present in kitty litter, toxoplasmosis. So if you've had toxoplasmosis before, it's safe. If you have not, you cannot be exposed to toxoplasmosis while you're pregnant. So that would be a hard no if you are not exposed. So just get the blood test for toxo. There's a whole bunch of TikTokers.
Hi, Dr. VNT. My ovaries and lining didn't respond well to the letrozole after 3 months of Lupron. Letrozole for endo.
Sure.
Trying gonal next. If so, how much?
Don't try gonal. Just wait a month and retry with the letrozole, and just at most add in 1 milligram or 2 milligrams of estrase per day. The gonal, if you're going to do it, it's 75 units a day, but you're going to have a sky-high estrogen level with that. So we try to avoid that when possible.
Been trying to TTC and testing ovulation, and I'm not getting peak tips to increase LH levels. When do I see a doctor?
Well, if you're not ovulating, you should always see your doctor, because we can give you medication to help you. So see us as soon as possible.
That was from TikTok, just so you know.
Yeah.
You talked about progesterone levels for endo to be about 150.
Yep.
Is there such a thing as too high?
Yeah. If it starts getting much over 150, it's going to be too high. So you have to be cautious. You don't want to be getting 170s, 180s, 200s, that kind of number. That's a bit on the high side for sure.
Hi, Dr. VNT. My ovaries and lining didn't respond well to did that one. Try and go on. Do you recommend more Lupron after a failed medicated cycle post down regulation, or will the effects of the Lupron remain despite the medicated cycle if I jump into a modified natural cycle?
Well, we always do the 3.75 shot of Lupron right before a FET, and I would advocate for that, but I wouldn't do another 3 months if you failed your first. I feel very comfortable continuing 3, 4, maybe even up to 6 months after a 3-month Lupron letrozole suppression before I would feel like you'd need to be resuppressed again.
Had a meeting with my RE today and left feeling like she wanted me to either try an IUI or stop trying to get her to do more tests on me. Are patients trying naturally of less value to an RE? I can answer it, but then I'll lose my doctorate.
Yeah. So yes, unfortunately, patients trying naturally are, from a financial standpoint, worth less to REs. And I'm just telling you the truth. I'm not supporting this whatsoever at all because I don't care about that at all. But most centers care less when you say you want to try naturally, or even if you want to do IUI, because we're not making anything from people trying naturally or doing IUI. You make the majority of your money from doing IVF. And so if you go to a clinic where they're focusing on the finances, they're going to push you more towards IVF. If you want to try naturally, you need a clinic like ours, which will support you through whatever you want. So we never tell people what to do unless it's crystal clear. So for example, your tubes are blocked, you have very severe male factor, you need IVF. Those are no-brainers. But for everybody else, we go through your history, we explain every single finding to you, we give you the options, which include trying naturally, and then I just say, you tell me what you want to do. Some people want to try naturally, great, hallelujah, that's what we do. Some people need time, or they want to try something in between, like IUI. And then there are, of course, people that say, yeah, we want to just jump right into IVF. So it's completely up to you, but you got to find a clinic that will support that. Many clinics do not support that. They will approach this from the standpoint of, you're not doing IVF, okay, you're not worth my time anymore. Go see my nurse, or go see my nurse practitioner, or whatever the case is. And so you're not getting the same level of care. Sure, it's true, you probably don't need as much attention if you're just trying naturally, but you still deserve access. And so we provide you with whatever you want. Like, I don't push people out or push them away or deflect them to somebody else if they're trying naturally. In fact, I kind of like it when you try naturally, because those are the hardest ones to actually achieve. IVF makes it easy. I know I'm going to do well. We have a great program and get almost anybody pregnant, but naturally getting people pregnant actually takes a lot of skill. So I feel like I've achieved more when I've helped someone naturally get pregnant than when I get them pregnant with IVF. So that's me, but I know I'm definitely in the minority on that one.
So Carly is giving a lot of great likes.
Okay.
And I'm forced to cut the line on her. I got to do it. Do progesterone suppositories raise the risk of cervical cancer?
Absolutely not. Cervical cancer is 100% caused by a sexually transmitted virus called human papillomavirus, HPV, and it is not hormonally responsive. It is responsive to nicotine. People that smoke have much higher rates of cancer, but that's it. Yeah. So as long as you're not smoking, you got your Gardasil vaccine when you were younger, you are very protected from cervical cancer. You probably don't need to worry about it too much. Hi, Cart.
When taking progesterone, are there any side effects?
Fatigue, nausea, breast tenderness sometimes, depression if you're taking too much, weight gain if you're taking it as a depot, bone loss if you take it as Depo-Provera and you take it for a long time. But otherwise, no.
Would you do anything for 1 centimeter fundal intramural fibroid that is abutting the endometrial lining but not in the cavity?
I'd have to look at it. If it was nudging into the cavity, I'd remove it. If it's not nudging and it's just sitting there, that's a very small fibroid. Probably not. Or at least I'd wait till it got bigger to go chase after it.
Hi, Dr. V.
Hello.
Have you ever experienced a patient having low TN alpha? If yes, Would it affect one getting pregnant? If yes, what would be the solution?
I haven't. We'd probably have to stimulate your immune system somehow. But the bigger question would be, does low TNF alpha have anything to do with an adverse fertility outcome? And that depends on what's going on in your body. So that would be super complicated. We'd have to evaluate that one carefully.
You're being challenged on TikTok.
I'm being challenged on TikTok? By
I
who?
thought cervical cancer was 95% from HPV, not 100.
It's 100% caused by HPV. Yeah.
Shots fired.
Shots fired. Yeah, no, it's not 95. 100% of cervical cancers are caused by human papillomavirus. It is always from human papillomavirus, in particular type 16 and 18, but there are other subtypes that can cause it as well, but it's always from HPV. I'm actually the regional director for cervical pathology and colposcopy, so I have to live and breathe this all the time.
That's amazing. You just threw that on the table like that. You're so great.
Yeah.
That's amazing.
It's on my
It just so happens to know that this is what I do every day.
Yeah, I'm on the provincial body for all this stuff.
So. You're like Batman. You know? You are really the Batman.
I am not Batman, not at all. I need a bat cave. I'm trying to get a bat cave, but my wife and I can't agree on any other part of the house.
You know what the problem is with that is that she's not supposed to know about the bat cave.
No, she knows about the bat cave.
Then it's not a bat
She's
cave.
agreed to that. I get my own little basement.
Does she know where? Does she know where it is?
Underground garage. Yeah.
No, she can't know. You have to do it all over again. Different spot. If she knows about it, it's not a bat cave anymore. New land purchase.
I don't think that's going to work. Yeah, no. But we can't decide on any other. Hey, listen, if any of you want to help, okay, my wife and I cannot decide on any part of a house design. So currently we are in standstill. And my son just used some choice words to describe me because of the failure of our construction of our house. It's terminology that's no longer considered culturally or politically appropriate, but in any event, yeah, I need a mediator so that my wife and I can actually agree on a house design. Yeah. Erica says, this house, I love this topic with you. Erica, when you come up north with us for Christmas, you can mediate. How's that? We'll put the baby down for a nap and you can mediate for us.
There you go.
Yeah.
It's easy. I'm in the same battle right now.
I did
as
just
well.
out Erica because she's coming up to our cottage.
I see that. That became clear that she'll be able to mediate.
Yeah.
My wife doesn't even want to move from the area. We're stuck in an area because I want to go to greater pastures. I want lands.
You want land now?
I want lands.
Oh.
I'm in the mood for land.
You didn't tell me that.
I'm in the mood for vast lands.
Vast lands.
Vast lands.
And now is not a good time.
Yeah. So obviously now is not a good time, but my wife wants to be in the city. I want to put on my cowboy boots and do like Yellowstone. I want to pull a Yellowstone. Not to the same extent, obviously, but I have been so inspired by Yellowstone that I want some horses. I don't know what I'm going to do with them. I don't know how I'm going to maintain them.
Horses.
Well, later down the line, I need 3-car garage. I need a couple cars in there.
Yeah.
And then I'll get the horses.
And then you get the horses.
Yeah. Like horses is in the game plan of, you know, I don't know if it's a bucket list or before I die or in the next 10 years. I can't decide.
That's a lot of work, buddy. Horses are not like a minor thing.
Yeah, I know. That's what makes it so much more challenging. And that's why when I tell my wife this theory, she gives me the look like, you're crazy. That's the look I get.
Yep, I get it.
You know what I mean? Yeah. But one can dream.
I want to be a fly on the wall when you and Murmur.
You want to be the mediator on that one, eh? It happens more often than you think, to be honest.
Yeah, I would love.
The other day, she's like, let's go to an open house. I said, what for? Do they have
in your neighborhood?
No, in LaSalle someplace.
Oh.
I said, for what? They don't have acres of land there for my horses.
No.
She goes, but we're not buying acres of land. I'm like, well, you're not moving. And then that was my Sunday. I had to deal with myself for the rest of the day. Yeah, I had to deal with the consequences of being me.
Oh, that's so funny.
So back to the subject of fertility.
Yeah.
What should the vitamin D level be at the start of an FET cycle?
Ideally over 75 nanomoles per liter.
Okay. Have you had experience using Plaquenil for FET?
Yep. We've used Plaquenil a couple of times. I use other stuff, excuse me, in particular intralipids, steroids, stuff like that. So we don't have as much of a need for Plaquenil, although our lupus patients come on Plaquenil already. So yeah, we've used it before. I have no trouble with it. It's safe. It's easy. It's very well tolerated. There are minimal to no risks in pregnancy. So yeah, it's a good drug to use for sure.
For immune protocol, using Claritin, Pepcid, and Benadryl, what is the purpose of taking all three, and is it safe to take 24-hour Claritin and Benadryl together?
I've never heard of anyone doing Claritin and Benadryl. I've seen Claritin and Pepcid or Benadryl and Pepcid, but I don't know why you would take Claritin and Benadryl and Pepcid. I've tried it before. It did nothing. I've looked it up. There is zero evidence. Tark and I actually looked it up together one day. Yeah, I'm not a believer in the H1H2 blockade yet. We're actually in the process of setting up a trial to look and see if pantoprazole can reduce contractions in the uterus, but it's not for H2 blockade. It's not for an immune mediated thing. It's to see if it'll reduce contractions because there's some evidence that it will. So that's something we're checking out, but we'll have to see how the study goes. I got students working on it right now.
When do you want patients going for gestational diabetes testing? Is it 26 weeks? Okay.
26 to 28 is the appropriate time. Oh, you just lost your battery.
I see that. Did we leave it on?
I don't think so. Do you have the plug?
Yeah. If an old cat is exhibiting new and bad behaviors, it's likely because he's out of sorts with the new kitty. Try a slower intro to help them get along more.
You can plug that in while I explain this one. So this has nothing to do with fertility, folks, but our outdoor cat is the older cat, only by a couple of years, but he is outdoor. This is a feral cat that we ended up adopting. He came in once. Occasionally he'll like eat inside, but generally speaking, he doesn't live inside. And so as a result, he is definitely a little bit of a more challenging kitty cat. That's going to have to go over. I'll run it through there and hopefully I'll find a spot for it. Yeah, there we go. How's that? So yeah, our outdoor cat is not necessarily a indoor friendly cat. I've been arguing with my wife about bringing in the outdoor cat, whose name is Toby, because he's a tabby. So they named him Toby the tabby, and he's super friendly, but I don't like. We've never picked him up. He hasn't sat on us. He's getting close with me. I think he really likes me now, so I'll go out and sit on the ledge with him for a minute, and he'll like run around my legs and stuff. But God, that guy's got razor blades for claws. So if he ever gets pissed off, I'm a goner. Yeah. Mithril acts all tough with him, but that's from the other side of the glass. So they're quite cute. Wendy has some really adorable pictures of the two of them together on the other side of a screen or glass or whatever. Yeah. You look confused.
Yeah, I just want to make sure I didn't read it. Hello, Dr. V and Terrific T. Low hormonal cyst, 25 millimeters. Proceed or cancel FET. Already cycled day 12.
Low hormonal cyst? Is that what you said?
Non-hormonal cyst.
Oh, non-hormonal cyst.
Yeah, non-hormonal.
25 millimeters?
Yeah.
Well, if it's non-hormonal, who cares? Go for it. Yeah.
So progesterone is 150 at transfer and you continue the same meds. Can it not increase the progesterone, or should you be lowering your PIO and vaginal prometrium after transfer if progesterone is already at 150?
If you're an endo patient, you want to keep it at 150. So you got to monitor it to make sure it stays there. Non-endo, you want to reduce it because that's too high for a non-endo patient.
Hi, Dr. V. How does a luteal phase stimulation work?
So eggs grow in waves. And so you can actually stimulate a patient at any point in time. You don't have to wait for follicular or luteal. You can randomly start stimulation at any point in time and patients will respond. The way a luteal is supposed to work from a duostim, you do your initial retrieval, You wait 5 days, you bring the patient back, and you start another stim. We frequently found that that resulted in fewer eggs because we were getting some of those smaller eggs in the hopes that they were mature during the follicular stim. And so they weren't there to retrieve when you went to the luteal. So we actually split our duostim apart now, where we do a follicular stim 1 month, and then we wait a month. We let the patient release their natural egg, or we trigger the release of the egg with GnRH agonist, and then we go and we chase down the luteal phase follicles with a stim 5 days later. And that gives us a lot more luteal phase eggs. So that's worked quite well for us.
Hi, do you know anything about LUFS, luteinized unruptured follicle syndrome, and what can be done once detected? Thanks.
Luteinized unruptured follicle syndrome?
Mm-hmm.
If you're referring to empty, I haven't heard it described like that before. If you're referring to empty follicle syndrome, I don't actually believe that empty follicles are real. Either you didn't release the egg because your trigger didn't work, or they didn't flush them out of you and they're sticky. But the idea that your estrogen level would go up and there's just no egg there, I mean, theoretically, it might be possible. I don't really believe it, because I know that when I flush, sometimes I had a patient the other day, I had to flush her follicles out 15 times to get the damn egg, but I got it. So it's actually rare that there's like truly no follicle. So if that's what you're referring to, I'm not a believer. I think it's a failure of us, or a failure of your biology to release the egg. I can cover the us part. The biology part I can kind of cover for people where we know that that's part of their history. Will triple trigger them. So a GnRH agonist and 2 shots of HCG, and then we measure levels and make sure they've worked, and then we go chase down the egg. If you, even with flushing, get nothing from that, from a triple trigger, yeah, there's clearly something wrong.
Going through miscarriage now.
Oh, I'm sorry.
My lining was 9.9 and IVF was successful. Bleeding in clots at 6 weeks. HR was present but still miscarried. Was on aspirin, estradiol, and progesterone. Could I have antiphospholipid syndrome?
Antiphospholipid syndrome? Yeah, that's a possibility. Certainly anytime there's a heartbeat and the heartbeat is detected and then you miscarry, that's rare. It's less than 2%. So there's a whole slew of things that need to be evaluated. But APS, antiphospholipid antibody syndrome, is one of the things we look for sure.
Hi, Dr. V. Does progesterone naturally fall after a fresh transfer? Transfer day 28.2, day 14, 53.7, day 11, 35.1 NGL, and 1 milliliter PiO to petroleum daily.
Your progesterone level shouldn't fall if you're pregnant. As long as you took it at the same time every day, and you took your levels at the same time every day, they should be fairly consistent. If not, something is amiss with either your injection or your levels, or that kind of thing. So I'd need to know more about what you're doing and how you're doing it. Did you see what's on TikTok? It says some comments in this live were filtered to protect the community's experience.
There you go.
I don't even know what that means.
Means
we get weird comments, but
means there was something rotten being said.
Something rotten.
Something rotten.
Okay.
Hi, Dr. Victory. You removed all of those random clarifications in my calcifications in my uterus. Just wanted to say hi, and that you have a wonderful team.
Oh, thank you. We do have a wonderful team. I was talking to my team today. They're a great group of people. They're very caring. They're very, very, very hardworking. They're very committed. They love doing what they do. It's not a 9-to-5 job for them, because I don't hire people that come here for a 9-to-5 job. I have a lot of trust for my team. That doesn't mean we don't oversee everything, but I do trust them. They're good people, and they work hard. And I'm really, really proud and honored to work with the people that we have here. They're all amazing, led by many managerial positions who are also phenomenal. Mara, Lisa, Dr. Khosravi. I mean, everybody in the managerial area here, whoever they may be, they're all awesome people. So, yeah.
How many lit treatments would be recommended for someone with negative / marginally positive LAD? Thanks.
So we're doing 2, and then a third one if your levels don't come up, so you measure them after 2. So yeah, we're trying for 2 now. We started with 1, now we're moving to 2, and then we're going to do a third one if you still don't mount enough of a response.
How long does one session take for lit therapy?
A minute.
Oh, really?
It takes about 3 hours to prep,
Oh,
but it takes me 1 minute to inject. It's just clean off here, and then go bloop, 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 and I go a little deeper on the third one, bloop, 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 a little deeper on
really?
It's like literally
That's
1
it.
minute.
Unbelievable.
Maybe 2 if they've got tough skin.
Sure. Of course.
Yeah.
Is birth control the only method of regulating hormones to avoid further cyst ruptures, attacks, and endo attacks?
No. Or Alyssa, Bizan, Lupron with Adbac, the Mirena IUD might work. So no, birth control is not the only way. Hormonal manipulation is, but it doesn't have to be the birth control pill. Excuse me.
Do you ever add Adderall as part of FET to help with implantation?
Adderall? Never even heard of Adderall being used, and I wouldn't because it's relatively contraindicated in pregnancy. So no, I would not be an advocate for using Adderall.
Is it possible to be given too much progesterone after an IUI that would prohibit you from getting pregnant? 6 IUIs, all unexplained infertility, hesitant to do IVF because there's no diagnosis.
I applaud you for being hesitant to do IVF without a diagnosis. Although keep in mind that IUI doesn't always work for unexplained infertility. Everybody deserves answers, so that's the kind of situation where I would want you to reach out and talk with us and see if we can figure out what's wrong, because often we can. And certainly in a case like that, I would strongly advocate for laparoscopy to evaluate and see if there's a sort of surgical or pathological reason for why it's not working, endo being number 1. But is there what was the original part of it?
She had no diagnosis.
No, before that she said, is there something?
Is it
6
possible?
IUIs.
6 IUIs,
Yeah.
all unexplained infertility. Progesterone, too much progesterone after an IUI.
Yeah, you could have too high a progesterone level. Progesterone given in sufficient dose is birth control. So you don't want to overdo it, you don't want to underdo it. There's like a delicate, narrow range where you want to be. Yeah.
Is there anything you prescribe to help with implantation?
Oh God. Loads of stuff, right? So vitamins, and then beyond that, it depends on what else is going on. So if it's a straightforward case, vitamins, progesterone, letrozole, we make sure you're on melatonin, baby aspirin. Those are the basics for us. Minimal to no estrogen, high doses of progesterone. If you have an issue like endo, we'll add in the endo medications and a whole endo protocol. If you have thin lining, we add in things for thin lining. If you have recurrent implantation failure, that's a whole other story. If you have, problems with your uterine microbiome or your immune system, that's a whole other story. So it all depends on what's going on and what's wrong. But our standard approach is just vitamin supplements, letrozole, baby aspirin, melatonin, that kind of thing. But it gets much more sophisticated when there's other issues going on. I mean, probably the wildest stuff we use is PRP, Neupogen, human growth hormone. We've got loads of things that we use that seem to improve the success rates, at least in our hands.
Hi, I'm 39 with PCO with 4 failed euploid transfers and 4 remaining.
Wow.
Normal HSG, sono, hysteroscopy, BMI, cholesterol, RPL, pano, OHIP covered biopsy, and blood work. I did a round of antibiotics and probiotics. Last cycle, we added metformin and fragment. I can do another transfer with the same protocol or chose to do 2 months of Vizan with another biopsy first.
Don't do that. Is there more to that question?
That's it.
Yeah, you need testing, and I would stop doing any embryo transfers to get answers. So you need testing, you need immunological testing, you need microbiome testing, you need laparoscopy to look for endo, and then you need to do a appropriate protocol. While you can just do the kitchen sink approach where you just kind of try everything, I'm moving further and further away from that because it doesn't make sense in this day and age when we can actually figure out what's wrong to just randomly throw everything at you and hope that something sticks. That doesn't make a lot of sense. So I would avoid that.
How to make the non-hormonal cyst disappear?
Surgery. There is no way to make a non-hormonal cyst disappear. You need to operate on them or drain them and then pray that it doesn't come back, which is rare. Usually when we drain cysts, they come back.
Would you do anything about a 1 centimeter? Oh,
yeah, so
that's interesting. Yeah. My RE said I had unexplained infertility.
Okay.
But I only had an HSG done, not a hysterosalpingogram or whatever it's called. Is this test valid to leave out if I had a uterine ultrasound?
I'm confused. So if you have an HSG, it's the X-ray dye test. And if you had an SIS, saline infusion sonohystogram, you had the ultrasound test. So HSGs don't give you nearly as much information as an SIS does. So we don't do HSGs here unless we fail the SIS. So if you haven't had an SIS, I'd advocate for that. I'm assuming they've done sperm testing, DNA fragmentation, they've done your hormones, they've mapped out your cycle, they've checked your AMH, they've looked at your vitamin levels, all of that stuff. Coital frequency, like there's a whole history that needs to be done. But if they've done all that, and the only thing that's remaining is either SIS or HSG, it should always be SIS first, not HSG. HSGs are cruel, useless, and don't give you nearly as much information as an SIS does. So it doesn't actually make sense for anybody to be getting those as first line. It should always be SIS first.
Are Hatch Duplo embryos lower success than hatching?
No. A fully hatched is a much higher success rate, but they are super difficult to manipulate because the minute they hatch, they actually start sticking to the plastic of the dishes that we keep them in. So you got to get them in quick. Like today we had one that was hatched and my embryologist called me and said, you can't wait, because we had to reschedule everybody, kind of not schedule, but reshuffle our schedule because I had to run back into the OR to do that embryo because it fully hatched out. So you got to be very careful with them because if you wait too long, they'll actually attach to the plastic of the plate. And then when you go to pull them off, they don't like being ripped off of the plastic.
Really?
Yeah.
Really?
Yeah.
Wow.
It's really wild. Yeah. So you don't want to wait too long. You can't leave hatched blasts just sitting around for a long time.
Could egg donations have triggered my now PCOS and possible endo for the medication 3-4 years later?
Endo maybe, because you're being stimulated with estrogen levels that go high, but PCOS, no.
What is the ideal estrogen level for an FET?
Anything over 100 is okay, according to one study we reviewed a few years back, but really we don't pay too much attention to it. It's not really important.
Hey, Dr. V, what is the ideal estrogen level for an FET? I just said that. Yeah, I know. I have endo and my previous RE refused to check P4 for transfer because they said serious P levels are on indicative of uterine levels. Thoughts?
Serum P levels are not indicative of uterine levels. Yeah, your RE doesn't know what they're doing.
It's the worst. The worst answer somebody could get.
I know. I'm sorry. Yeah, that's my lack of filter me.
I like that though. It's a good short.
Yeah.
How long after miscarriage would you wait to do a hysteroscopy?
Well, I guess I'd ask why you're doing a hysteroscopy after miscarriage, but I'd wait till after you'd had your next period, but I wouldn't necessarily be doing a hysteroscopy on someone that had a miscarriage unless there's a problem.
Can you get adenomyosis post C-section? And what can be done for it? Symptoms are significant bleeding and pelvic painfulness. pelvic pain, comma, fullness.
You shouldn't be getting adenomyosis after a C-section because it's built into the wall of the uterus, unless they somehow buried your endometrium in your C-section scar, which would be weird, but I guess it's possible. But you can get cesarean scar endometriosis, although that's typically in the wound, like in your skin wound, not in your uterus. So no, not usually.
Other than side effects to the mother, can anything happen to the baby with too high progesterone?
There's some suggestion that it can alter penile development, but I've only seen it once, and there's no way to know if it was related to the prog.
Other than side of how much progesterone do you put your endo patients on at your clinic?
1 mil PIO and 600 milligrams of permetrium, 2 crinone per day, or 1 endometrium 3 times a day. So any of those 3. And then we adjust the levels based on checking after 3 days of use.
What is the success rate for unexplained fertility with IUI?
With pills, 8%. With shots, about 20. That's just like an overall number, but keep in mind it depends on age, BMI, sperm quality, your personal habits, all that stuff.
Is PCOS caused by being overweight, or do you think it's randomized? I know some can have lean PCOS.
PCOS is most likely genetic. Being overweight does not cause PCOS, although it can unmask PCOS. But PCOS does cause women to gain weight. So your weight can unmask PCOS, and certainly PCOS can make you gain weight. It can turn into a vicious circle. But generally speaking, not all women who are struggling with their weight being higher actually have PCOS.
Can you get adenomyosis? Oh, would you ever suggest suppression prior to a transfer for someone with suspected endo prior to a lap? The wait times in my region for an OB surgery are very long.
Well, yes, except that ideally you do get the lap as part of that suppression period of time. So, I mean, if you're talking about being suppressed for a year and waiting for a lap, no, I mean, it's way too long a period of suppression. So we, in our protocol, we suppress and operate in the suppression interval of 3 months. But if they can't achieve that for you, I'd either do the suppression and then go straight into transfer, or I would wait to do the suppression, the hardcore suppression, and just use some other kind of suppression.
Regarding the vitamin D levels at the start of an FET,
Yeah.
you said it should be 75 and above.
Yeah.
Mine is 43. Should I cancel it and get levels up? And how long do you think it would take to get levels up?
Yeah, that's a great question. I don't know that I'd cancel your FET. I would just jack up your vitamin D levels. It doesn't take long to get them up. So just take a lot more vitamin D and hope that that works. It is tough to get vitamin D levels up in some people, so it doesn't always work. There are lots of studies showing that it does impact success. Less so with FET and more so just natural, but there's no question that has an impact on your overall fertility. So yeah, if you're worried, you can certainly cancel, but otherwise I would just kind of take a lot more vitamin D. So 5,000 units a day or the 50,000 a week, like that'll very rapidly jack up your levels.
I have that 50,000 a week at my house. I saw it.
You do?
Yeah.
Do you use it?
I go outside. I don't get it.
Yeah, I don't. I'm stuck in here all till 9 o'clock at night.
I go outside. But I don't think there's any sunlight anymore in the wintertime here. I think it's done. Sunlight's over. I got some solar power cameras at my house.
Yeah. They're dead.
They're dead. I tried to be green. Green failed me.
Green failed you? Really?
Yeah.
The cameras are dead.
Dead. Straight up dead.
Wow.
Yeah. And then they work great in the summer. Like in the summertime, now it's dead.
What do you have, Arlo?
No, Ring.
Oh, you have Ring.
Yeah.
I have, what do I have? I have Google
You have
Nest.
Google. You have Google, yeah.
It works fine.
You have the solar panel one?
No,
Yeah.
I just charge it and it's good for like 3 months, even in the winter.
With the battery?
Yeah.
Really?
You got the wrong system, dude.
Sucks. And I'm not going up on my roof in the wintertime. That's
Don't do that.
Yeah.
Bad idea.
Is one follicle 18 millimeters good potential for IUI? Do we usually expect more than one follicle to be ready every cycle with menopause meds?
Usually you'd expect more than one, but one's still decent. Yeah. Carly's asked the same question twice. I think she's mad you've ignored her.
There's just a lot of questions. I'm going through them.
For a normal, healthy pregnancy, when do I suggest induction? 39 weeks.
All right.
We have a whole video on it. I think that one's our second most popular
Yeah, it's
video.
a big one. It is a big one. Yeah.
Yeah.
Jackson Galaxy is to cat behaviors as you are to human reproduction.
Jackson Galaxy. Oh, that's the guy's name.
That's the guy's
I'm
name.
gonna have to check that out.
That is who you are in terms of human reproduction. I like that.
Jackson. Thank you for the compliment. I don't know who Jackson Galaxy
He's
is.
probably super cool.
I hope so.
Yeah, we definitely hope so.
Yeah.
How to check your microbiome if no period because of Lupron?
You can't. And probably shouldn't. The only way to do it would be to do a biopsy. And if you're on Lupron, your lining is going to be thin and you could potentially cause scarring from a biopsy. So I'd be very cautious with that one.
Does Hashimoto's cause infertility?
Depends on who you believe, but I would strongly argue yes. High antibody levels, irregular thyroid levels. Irregular thyroid levels known to cause infertility. High antibody levels controversial, but I'm a believer that it interferes.
When should Omnitrope start if it's part of your protocol? I've read conflicting info.
For STIM or for FET, we don't know. Yeah, if it's for STIM, 2 weeks before. The studies have done anywhere from 6 weeks to starting with STIM. We do 2 weeks before. For FET, it depends on what you're using it for. So you'd have to tell me what you're using it for, and then I could figure it out.
Hello, Dream Team. Can you improve sperm morphology, and how do lands ensure that they picked a good swimmer and not screwed up one?
Yes, you can improve it. Vitamins, frequent ejaculation, no smoking, no drinking, no drug use, eat healthy, avoid heat, keep your testicles cold. So all of those things will help. How does the lab make sure that they're using the right one? They spend hours looking under these insanely expensive microscopes, which we now have 2 of, at $120,000 a piece. And those tell them if the sperm is normal or not. They can look at it under great magnification and literally individually pick the best sperm. 9 o'clock, buddy.
9 o'clock.
Is it a crazy show?
It's good.
It's
all
a
right.
good show.
Yeah, it's a good
right.
show. Yeah.
Couple more minutes.
Yeah, you can do that.
All right, fire away.
Here's an interesting question. Do sperm issues get passed down to your son? My mother-in-law claims that her husband was encapsulated, so they had to do an IUI, but zero clue what she means.
I don't know what encapsulated means either, but yes, sperm problems are hereditary for sure.
Does it matter which side you do your injections on? Is it okay to do all in one spot, or is rotating spots better? I've been taking turns with putting gonal in left one night and right on the next, and same with Menopur.
Yeah, just don't use the same spot.
I had a terrible reaction. This is a different person. I had a terrible reaction to estrogen before retrieval stims and my first attempt at FET. I'm having to do another egg retrieval in January, and I'm saying I don't want to prime with estro. Is this okay?
Estrogen priming has been proven to be useless and probably detrimental, so don't use it.
There you go.
Yeah.
Made her day.
That was my scrap piece of, you know what, the Chinese food menu, it was.
Oh, that was your scrap
I
paper?
thought of it was estrogen priming article.
That's hilarious.
Yeah.
Is 162 milligrams of aspirin too much?
Oh,
was prescribed to start at this amount at 12 weeks.
yep. That's the right amount.
That's right amount. My estrogen level and FET prep without priming were the same in 6 FET attempts.
My estrogen level and priming?
And FET prep without priming were the same in 6 FET attempts.
I'm not sure where the question is there.
That's all I got.
Uh,
All right.
Can't help you with that.
My RE stated that they would not measure serum P4 as it's not reflective of uterine levels. Is there truth to this?
No,
Oh, wow. No.
no.
That's great. My ADHD psychiatrist said Adderall and Vizan are contraindicated to TTC and pregnancy.
Right.
Please use caution with any ADHD meds.
Well, Vizan you definitely can't use. It's relative birth control. And you shouldn't be on any ADHD meds. That's what I said earlier.
Yeah. Does near infrared light therapy beneficial when TTC?
We don't know, but there's studies that say that it is.
I have 6 eggs frozen from 2019 and just had a lap after 2 failed chemical FET with PGT embryos.
Oh, wow.
Are there any tests I should do, or what protocol should I do retrieval and fresh transfer with the 2019s?
Well, retrieval you wouldn't be doing with 2019 eggs. You'd make your embryos, get them PGT tested, and then depending on what they saw in your laparoscopy, if you have endo, we'd have to do an endo protocol. If you don't have endo, I would use a letrozole protocol, lots of vitamins. Arguably, if you failed 2 PGT transfers, we would advocate for additional testing, immunological, microbiome, stuff like that.
What's the most amount of multiples you've had with a patient? Were they healthy?
Oof. We once, actually twice, have had quintuplets, and another time a colleague of mine ended up with septuplets. So those are not proud moments. I will freely admit that we were very careful in those and were utterly shocked when they happened. But no, you cannot carry 5 babies, and they now recommend you terminate the whole pregnancy, because if you wait till 14, 15 weeks, which is when they wait till to terminate individual fetuses, there's so much necrotic tissue in there that it causes the other babies to be born very early, and so it's very risky. So nowadays, in the past, they used to say, we'll go in and we'll terminate. They now realize that there's a lot of risk with that. So unless it's triplets being reduced down to twins, they'll tell you to terminate the whole pregnancy. So yeah, we've had some very uncomfortable moments for sure.
I have had 2 miscarriages at 6 weeks and 7 weeks with euploid embryos. Stage 4 endometriosis.
Question, or that's just a statement?
Hi, this is the same person. I'm not sure if it's follow up or what, but hi, my Emma Alice biopsy keeps coming back positive for bad bacteria infection, even after antibiotics and probiotics. I've done 3 biopsies.
Stop doing biopsies. Stop using Emma and Alice. Call us. I'll tell you what to do.
There you go. Easy answer.
Easy, yeah. You need fertility cyst and targeted antibiotic therapy, which Emma and Alice doesn't give you necessarily. So, and frequently make sure your partner's treated, and then you need retesting before you go through with it. And don't do endometrial biopsies; they're horrible, and painful and evil. So, yeah, don't do that.
Currently doing PIO and progesterone, SUP.
Okay.
Do the SUP have to be at the same time every day? Mornings during week versus weekends might be different times when I wake up?
Yeah, it's fine. Don't worry. Any time is reasonable.
Can you further explain the results above?
What results above?
Oh, what to see? Maybe below. Maybe below.
Above, below, above.
Can you move to Australia while scrolling below? Can you move to Australia and be my specialist, please?
I'm coming to Australia 3 times or 2 times next year, but I'm not moving to Australia. No, sorry. But we will be there, and maybe Tarek and I will arrange a show.
You should.
I signed up for London too.
You did, eh?
Yeah, expensive as hell, but
It's
if you're watching us in the UK, we're coming. We'll be there for the London Fertility Show. We got a whole booth.
amazing.
Yeah.
How would people like that? Can you throw that question out there?
Throw what question at?
If going to one of these cities, doing like a little tour.
Would people want
Yeah,
us to have a live?
like they come there and
Tarek wants to know if you live outside of North America, if we're coming to your city, Brussels, Berlin, Australia, we're going to be in Melbourne, Sydney, Brisbane, and we're also going to be in New Zealand too, wherever their capital is. Oh, we're also going to potentially be in Perth, London, England, any of these places, Dublin. Would you want us to be alive in person where we could actually meet you? So tell us if that's something you want to be aware of.
we are seriously reading the comments for the yes or no right now. So let people.
Yeah.
If anyone's interested in a live tour, we are definitely checking.
I got some I can answer, although there was one behind.
I can get it for you.
Yeah, give me the last one that you had.
You suggest curcumin for endo patients. I read it can thin lining. Is that true? And how much do you suggest?
We use 60 milligrams. I haven't seen it in the lining, so I just use it. I don't have a problem with it. I've got a great question.
Go ahead.
Can I become your patient living 7 hours away? Do you have satellite clinics? Yes, we have satellite clinics. Yes, you can become my patient living 7 hours away. We have patients in Australia, so believe me, 7 hours is nothing. There's all sorts of ways to help patients from all over the place, so don't hesitate.
Does your clinic close for the holidays?
Yes.
What is the maximum level for estrogen?
Well, there isn't a max, but the higher the level goes, the more complicated the risks are. So you got to be careful.
Can a high BP patient female choose IVF at the age of 33?
Can a high BP patient? Yeah, of course. You just have to have your blood pressure controlled. Yep.
Hi, Doc. What do you use to enhance implantation for recurrent implantation failure?
First, I figure out what's wrong. Then I target my treatment to what's wrong. So I don't just blanket throw stuff at people.
Hi, Dr. VNT. Why does Lupron work for someone with no visible endo, hydrosalpinx, or signs of adenomyosis? And do you think BCL6 is useful at all, even if it doesn't indicate endometriosis?
No, BCL6 has been proven to be useless. And I don't use Lupron for patients that don't have endo for suppression. We use it for patients doing FET protocols for just 1 month because that's been shown to improve the outcome, but we don't use it for patients who have no endo for suppression. I think we got to call it quits, buddy. It's 9:10.
9:10. Let's
I
go.
got a hungry kitty at home.
Yeah, no worries.
You were looking like you were loving your computer so much you wanted to keep going.
I just want to keep scrolling.
Tarek's got a new computer. All right, guys, have a great night. We will see you. Oh, wait, next week I have a dinner.
Okay.
So next week there's no show.
Okay.
Or we got to do something.
Figure that out?
Yeah.
Okay.
Next week, we'll let you know. We'll advertise on all the various platforms. Please check out our YouTube channel if you haven't already. Hit that like button and make sure you subscribe. Tell all your friends. Watch our video on birth control. It's actually really good. And let us know if you have any feedback, comments, criticisms, things you want to know. Let us know about the show in other countries. If you live in other countries, would you like to come see us live? Have a good night, guys. Love you all. Fertility Fact or Fiction.